Welcome back to Houston Life. When it comes to oral health, there are a number of conditions and even medications that can affect your teeth and gums. One solution you've probably heard us chat about here on Houston Life is the one arch procedure. Joining us now with more on gum and oral health, periodontist and dental implant specialist, Dr. Michelle Azar. Dr. Michelle Azar, you are, of course, the founder of the Texas Dental Implant Center. It's good to have you back. I was surprised to hear many common medications can harm oral health.
Yeah. Most common medications prescribed for example, hypertension, allergies, even weight loss medications can cause decay. And the main mode of action is it affects salivary glands. Salivary glands is what produces saliva in your mouth. So it dries your mouth up. And that's a problem because saliva actually protects your teeth from getting decay.
And what's interesting, recent studies show that about half of Americans are on at least one prescription drug. Many times the number of drugs you're on increases as we age. So it's particularly important for people to pay attention to their oral health. Let's circle back to dry mouth. Dry mouth, when you talk about the salivary glands, this is not just something that is uncomfortable, but it can actually be damaging to your oral health and your overall health.
Yeah. The most common medications that can cause dry mouth immediately are, of course, diuretics, like pills or water pills, as it's referred to. Its process is to eliminate water from your body, and so affects the salivary glands. And so most patients who take it, or people who take that, will feel dry mouth, and they'll feel that they always want water with them, which is highly recommended that they walk around with water all the time to substitute for that water loss. But it also affects teeth because salivary glands protect your teeth and prevent decay.
And I was surprised to hear that even like common weight loss drugs like GLP-1s can affect people's oral health. And the whole point of this conversation, by the way, is to be proactive, right? If you know that you are at higher risk, if you're on one of these medications, then maybe what do? Do we increase our visits to the dentist or periodontist?
Definitely, yeah. And American Dental Association had come with a study that shows the high link between GLP-1 medications and prevalence of new decay or new lesions in the mouth. So my advice to anyone who starts any medications in general is to bring it up to their dentist and ask about what can we do proactively to prevent damage of teeth. So my advice is go to your dentist and maybe increase your maintenance visits. If you're going 2 times a year, let's make that 3 or 4 times a year.
Okay, so more regular visits, just more awareness that maybe you are at risk. Being proactive, obviously, that is key, but obviously our viewers have seen you on the show talking about full arch implants, essentially, that can replace what's lost.
Yeah, so if you're still in the early phases, traditional dentistry is going to work perfectly, and then you can do the maintenance visits and prevent these problems from happening. Now, if you're someone who has been taking these medications and you already see the problem in your mouth, then I think the best option to do here is to do the implants route instead of doing new crowns, because by doing the dental implants, you're not only restoring health and teeth function, but also dental implants do not get decay, which is a big part of the problem that these medications start.
And this is something for anyone out there who's been in a situation where they've had even one crown, multiple crowns. I mean, it's costly, it's time consuming, it drags out over the years. They can break, they can fall out, they need to be replaced. This is a personal situation for so many people, but it's important to note you see this with your customers, your clients, every single week.
Yeah, so this example here, missing teeth, and started on diuretics for heart condition, and then the dry mouth can cause the decay to progress much faster, and you can see the result. And then this is after taking the teeth out. We took the teeth out because we don't want any more decay to happen, and then restart with the implants. And like a cherry on top, we just address the cosmetics for the patients to be happy and just get to live their life.
And that's such a key point that you're making now. We've had so many of your clients right here on this program talking about how they would hide their smile. They didn't feel confident going into social situations. But even just the mechanics of being able to chew, eat a sandwich, and live your life. I mean, that is something that a lot of people are faced with as a barrier every single day.
Absolutely. Eating whatever you like, family pictures. We're in summer, the family trips are coming, and we don't want anyone to miss on that.
These before and after photos are absolutely stunning. And again, I know you see this all the time. For folks out there who were maybe told by a dentist or a periodontist, hey, you have really no options because you have too much bone loss. These are more difficult cases, but again, you see these all the time.
Yeah, and I think that what makes our consultation different is we go over the x-rays, and for these patients who are told that they don't have enough bone, we kind of reassure them because we're trained to handle tougher cases that a normal general dentist don't normally do on a daily basis.
We're seeing some video right now of the process, these digital mock-ups, the digital labs that you do so people are able to see, and then these are created in what years ago would have been considered, Dr. Azar, unheard of.
Yeah. All of this used to be outsourced to dental labs. Some offices use this lab in California or in Houston. Now we have it all in our office. And a lot of our patients do like to see the process itself as their teeth are being made. And they can get the chance to choose their teeth and color and everything.
It really is incredible. And a reminder, so many of these common medications can cause tooth decay, issues with gums, with bone loss, but the important thing to note is obviously prevention is key and being proactive, going to see your dentist more often if you're on these medications. But the good news is there is a solution if people need you.
Correct.
All right, Dr. Michelle Azar, it's great to see you.
Thanks for having me.
Texas Dental Implant Center. I still can't believe these before and after photos. They do have a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. That includes a one-on-one chat with Dr. Azar, a 3D scan and x-rays. That's all a $1,000 value. If you'd like to schedule your appointment, you can call 346-1ARCH. That's 346-663-2724. You can also go online, bestdentalimplantshouston.com. And Houston Life will be right back. Don't go away.